Uh, I want to switch our attention now with regards to psychedelic compounds and offset times, which are a hot topic, meaning compounds such as LSD and psilocybin are long lasting and they maintain intense psychoactive efforts for several hours after the first dose. So currently, several companies are working on proprietary formulations to shorten the length of the high to make it more suitable for outpatient therapy. So, as I outline this, I'd like to know can extraction formulations be customized, I guess, to lower trip times to be more manageable for patients? And if so, is that something we will see as the industry evolves?
Yeah, you can shorten and lengthen drugs. It's easier to lengthen them. Like we use it's a compound called E4M a lot in the pharmacy world, where
Okay.
it's a kind of a cellulose matrix that you blend the drug molecules into, and so it really delays the effects of the drug in the body. So it'll I don't know if you've tried psilocybin, it can be very upsetting to your guts
Mm,
and be quite uncomfortable. And so adding it with food or a delayed release is quite beneficial, because you don't want to kind of scare patients away with the negative side effects. You want it
right.
to be as easy and dosed appropriately as possible. And then to speed it up, you want to have a quicker absorption. So you want to be able to have a smaller molecule and make sure it's the right. You want to make sure it's depending on what membrane you're going to be getting into. If it's getting into the brain, it needs to be more fat soluble. If it's more into the body, you need to be more water soluble. So you can play with the hydrophilicness of the drug, and by adding some chains to it, or encapsulating it in a sugar molecule,
Yeah.
or doing a number of different things like that. So absolutely, we will be making sure that we listen to the patients, right, through the clinics, and see, well, what do you want? How can we help you have a better experience, journey, and therapeutic result? And so we're taking the data from the clinics real time and then applying it to the formulations and coming up with our own proprietary formulation.
Mm. Very interesting to say the least, because I know that's been a hot topic with a lot of people asking questions, especially when I look at some of the research that's being related to DMT. It's obviously a lot stronger experience for a lot of people, but it's the short time. We got a little stranger, a little friend here joining
Yeah,
us here in the interview today.
this is Walter. He's kind of nipping at my feet here, so he's distracting me a little bit while I'm on camera with you. So
All good,
yeah,
all good. I
yeah.
want to I want to focus on your corporate deck. You recently highlighted 190% growth in quarterly revenues year over year and record aggregate sales results in back-to-back months in both July and August. And as we know in this country, it's very highly competitive in this market. So curious to know how much more room for growth remains here in Canada in the extraction market, knowing it's been challenging times for this country with regards to it the last couple of years.
We're Chad, we're coming out guns a blazing. So we're in over 1,500 retailers right now,
Yep.
and we're using that as kind of a shoehorn for flower. So
Okay.
flower, as you know, is over 50% of the market. And also into medical, I believe that there's a huge hole in the legislature where bud tenders are not allowed to talk about anything health related, and we have droves of the teenagers, I call them, like our parents.
Yep.
They're teenagers, but they're teenagers. They still want to get going and live,
Yep.
right? So the teenagers are coming in there trying to, they're really curious about CBD, but
Okay.
yet so the pharmacies aren't allowed to sell CBD, right? The mainstream medical system does not understand cannabis yet. You have to go to a specialized clinic like Perceive MD, right? And so the vast majority of health of CBD and the benefits is in this black box of, there's nowhere to go and get the right information easily. So I believe that you're going to have CBD being able to be sold through pharmacies where it should be, because there is a lot of interactions with other medications, and the best professionals to be able to deal with that is through pharmacies.
Mm-hmm.
So having your CBDs sold through drugstores is the smartest legislative pathway.
Mm-hmm.
So But to answer your question, I think that we're going to be doing over 5 million a month in sales.
Wow.
We're doing just over 2 million right now, and we're growing like crazy. So when you have the retail distribution footprint or the shelf space,
Which you do.
Which we do, all right, we've got a wonderful sales team and we're very aggressive. And we've got we are kind of the Budweiser for extractions. We want to be everywhere and service the people. And then we're going to be adding to that existing footprint with specialty products like flour. We're going to be coming out with our own flour line, and we're going to be coming out with our own medical line. And and then psychedelics. So you're going to have multiple new streams of revenue coming through that facility. Like, you got to remember, we built that facility to last. It's in a wonderful location in Langley.
Okay.
I don't know if you've been to Langley, but it is like a shipping manufacturing hub of the West Coast. Like, it's all there.
Yep.
And so it's very easy for shipping lines. We're in a great accessible location there to ship these products across the country, and we have the facility to be able to add all these new revenue streams without adding any more capital expenses.
So 1,500 retail locations. With your background, like, do you believe it's only a matter of time before pharmacies will be selling CBD?
I think it's within the year.
You do?
Like, say 12 months. Yeah, I do.
So once that, and if that does happen, how much growth opportunities that present for you? Because I would think with your background and already a well-established footprint and a pending license, obviously, with Health Canada, as far as the psychedelic side is concerned, big growth opportunities, I would think, still within Canada, correct?
Oh yeah, so I'm still the director of so I still own drugstores and clinics, and but a large portfolio of mine was acquired back in 2017 by a company that's now called Neighborly.
Okay.
And they're on the stock exchange there, and they have about 160, 170 pharmacies across Canada.
Wow.
And I'm very close with, I've got buddies working at Shoppers and Rexall and this and that. And so, and I'm very familiar with McKesson and all the people there. So, and I'm still a director of BC for about, 20 or so pharmacies. So I have very good hooks into or connections into the pharmaceutical world where, it's going to be very straightforward for me to scale out any type of, pharmaceutical, CBD type product into the retail setting.
I like the approach. Last to eat at the dinner table. And this industry was a prime example, as the first person does not always win the race. And that is clearly evident in the cannabis landscape. But it's stories like this that are great to uncover, because as much as there's a perception out there where Canada lost out on its opportunity, it's still a very lucrative market, which we're clearly understanding. Last thing I wanted to ask, you mentioned recently that you intend to aggressively pursue opportunities with selected partners in strategic locations around the globe. Obviously, without getting into details about who you've been talking with and where, what might expansion, I guess, look like in international markets in the near future?
Yeah, like, we got to remember that we're maybe in, we're just in the beginning of the global cannabis, journey. And I believe that having the knowledge and horsepower that we do have at Adastra, I'm looking at other countries that have GMP certification, which means you can ship, GMP is good manufacturing practices. You have to have the regulation to be able to ship products like a drug into other countries. And so I find that while it's pretty expensive in Canada to produce, to be growing and producing, and then shipping out of Canada, and there's a lot of regulatory framework to go along with it. So I'm looking at cheaper alternatives to be able to grow and extract and produce cannabis in cheaper countries, and then to be able to kind of still get into those other countries like Europe and have phytoextractions in our branded products go into bigger markets. And so, and again, we have very little debt. We own the building, we own the land, and that's the only debt we have at Adastra. And we're cash flowing, we're cash flow positive.
Yeah.
And we have a very, very great capital market structure with our shell. And so we don't have a lot of downward pressure. And so we can sit and wait and acquire smartly to be able to grow our brand and our know-how into bigger markets. And that's exactly what I intend to do.
It's great. Great update. So if I'm an investor, where do I find you? Under what ticker symbol and what exchange?
We're on the CSE right now under XTRX.
Okay. Awesome. I appreciate the update. This has been fascinating, but lots of stuff to learn and a complete understanding of what's at stake, obviously, here in Canada, but not most importantly, too, just how much further ahead we are versus competition, let's say in Europe, and the opportunities that it presents. But I really appreciate you checking in with us here today, and let's keep in touch.
Awesome. Thank you so much, Chad. I really appreciate coming on the show. And yeah, it's been great. Thank you.
First of many. So let's keep it going, right?
Yeah, exactly.
All right. Thanks, Michael.
Thank you so much. Take care.